Goeiedag, good day, fellow South Africans and citizens of the world. And earlier this month we had a live stream with a doctor who remains anonymous, blowing the whistle on the race-based way that people are selected to get into the medical profession in South Africa. And then the hurdles and the loops that doctors who actually go overseas to get their medical degree have to go through when they come back to South Africa to actually be accepted as doctors. Absolutely ridiculous. And now the situation is coming home to bite the health department, where there's a huge and critical shortage of doctors at this time when COVID-19 is starting to grow and just infest the whole of the community. The KwaZulu-Natal Department of Health has come under fire for unemployed healthcare graduates who recently found out they won't be paid to assist during the COVID-19 fight. The graduates said while other provinces were working to employ more health workers during the pandemic, KwaZulu-Natal was calling for volunteers who would not be paid. In its appeal for volunteers, the department called on student doctors, unemployed health professionals, retired health practitioners and emergency personnel who are not employed by the department to come forward. So now they want to get people working for free for them, don't they? Health graduate Sandile Msisi said he had called the number of the advertisement to query, but after being told there would be no stipend or any form of payment, he dropped the call. He said, "I'm an unemployed graduate. I paid for my studies for 4 years. I can't go out and risk my life for nothing. If they have vacant posts, they should employ those unemployed graduates, just like other provinces." Mnisi said given the danger posed by the virus, volunteers should be offered a stipend. He said, "We read the news and we know that KwaZulu-Natal has the highest number of deaths due to COVID-19, and also there are a lot of health workers that have been infected. Only a fool will volunteer. The government must do what is right and employ graduates and unemployed health officials." Qualified nurse Samkelo Gianni said she was among 240 professional nurses who were trained by the Department of Health through bursary studies, in terms of which they were supposed to be appointed permanently after training. But Gianni said 4 months after community service, she and the others were still unemployed. She said they were told that the department did not have funded posts to hire them. Spokesperson for the KwaZulu-Natal Department of Health, Ntokozo Mafisa, said the department had been approached by a number of healthcare professionals who wanted to volunteer their services. Mafisa said the department therefore decided to compile a database of those who wanted to volunteer. There will be no financial incentive for this category of workers. The department is finalizing its needs analysis study, which ultimately determines the category, number and location of healthcare workers who will be formally recruited to bolster its human resources. Meanwhile, a South African doctor who received his medical qualification abroad said it was unjust that the government had sought doctors from China and Cuba when there were hundreds of local foreign-trained doctors being prevented from working. And that was exactly what that live stream was all about earlier this month with that lady doctor. The doctor, whose identity is known to the Mercury but requested to remain anonymous, was speaking following the announcement by Minister of Health Dr. Zweli Mkhize that South Africa had approached China and Cuba for medical assistance. The doctor said he had been battling to qualify to work in the country since 2017. He said there were dozens of foreign-trained doctors in the same predicament. He said these doctors were waiting to serve and be on the front line in the fight against COVID-19. He said foreign-trained doctors had to navigate a long and onerous process managed by the Health Professional Council of South Africa, the infamous HPCSA, in order to be allowed to work. He said the HPCSA only conducted 2 exams per year, which foreign-trained doctors had to pass to be able to work in the country. He said due to there being only 2 exams, some candidates had to wait long periods to write. He said sometimes the application process alone before being accepted can span up to 2 years. Once it is accepted, only 120 applicants are allowed to take the exam, where previously this number was 200. In addition, the doctor said the practical component of the exam had an extremely high failure rate. The HPCSA did not respond to a request for comment sent last week. Well, the HPCSA are a complete disgrace to their profession. Anyway, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. And if you're in South Africa and you go to a hospital where there are no doctors, understand there are hundreds of doctors who've qualified, but the HPCSA is preventing them from practicing. That's the harsh reality.